Hello and welcome to this edition of the ACC Update. I'm Kimberly Suiters. Appropriate use criteria, or AUC, are intended to define when and how often to do a given procedure in the context of scientific evidence, the healthcare environment, a patient's profile, and a physician's judgment. The college has come a long way over the last several years developing AUC. To date, members of Congress and payers alike have credited AUC for helping to reduce unnecessary imaging tests. AUC serve as tools for improving quality care and saving healthcare dollars. As a result of these successes, the college has released new methodology for the development of AUC to encourage even greater use and adoption. Joining us today to talk about some of the new AUC changes is ACC President Dr. William Zogby. Dr. Zogby, thank you so much for joining us.
It's great to be with you.
Let's talk this morning, of course, about AUC. How are they developed?
Well, AUC tell us basically of when to do a certain procedure or management, and they were developed by an expert panel relying on the evidence from the American College of Cardiology and our partner societies, and also from expert opinion when there is no evidence to support, clinical decision making. So I think this is very important for us to incorporate in these appropriate use criteria.
Now, there have been some changes to the AUC methodology. Can you address those?
Yes, I mean, part of the evolution of this is what the experts would look at is risk and benefit ratio and the newer scenarios, newer clinical scenarios. So I think AUCs have addressed many changes in these clinical scenarios and also have evolved over time. Larger panels to address this, and earlier rolling of these AUCs, and most recently it changes in the terminology, and I think we've addressed that at the board. And what you see, the changes in terminology is changes from appropriate, uncertain, and inappropriate to terminology that addresses more the clinical scenario, as well as that these AUCs are more population-based. So the terminology will be appropriate care, maybe appropriate care, or rarely appropriate care.
And these turn out to be much better terms.
Much better. I think we've done quite a bit of research to do this. We even talked to the inventors of the methodology to get their approval and their thoughts regarding that. So a lot of research went into that, and this will be rolling out early 2013 with a communication for that.
All right, so you answered part of our next question, and that is, does the ACC have other plans for AUC moving forward?
I think the other plans are, one, to understand this terminology and know that this is an evolving field. So you'll have updates in methodology. Number one, I think it's very important for other stakeholders to understand the importance and the meaning of these AUCs, meaning members of Congress, the media, other stakeholders, and I think this is, and payers. And I think this is very important because we want to strive for quality care. Now, these would not be a substitute for clinical judgment. Clinical judgment is certainly very important when you deal with so many comorbidities and other factors, but I think at least it's a guide to help us.
Everyone's speaking the same language.
Exactly. And last but not least, is patient engagement. I think these are, in a way, a starting of a conversation with patients, and that's why we joined Choosing Wisely campaign from the American Board of Internal Medicine Foundation. To start thinking of where some tests may not necessarily be appropriate or may not help in improving outcome, improving quality of individuals if they get it, yes or no, and certainly also procedures. So I think this is very important to engage patients in their decision making.
Dr. Zogby, thank you so much.
Pleasure being with you.
To learn more about the methodology changes, go to cardiosource.org/focus. There you'll find useful ACC tools and resources that help ensure the most appropriate care at just the right time. That's it for this ACC update. Join us again and stay tuned to CardioSource for all the latest news from your college. I'm Kimberly Suiters. Thanks for watching.